afternoon, students. We can study about the uterus. Uterus, as you all know, is known as womb, which is a childbearing organ in the females. And this is our uterus. Here we can see this is your uterus. Here comes the vagina. This is urinary bladder. This is uterine tube, and this is ovary. Here comes the rectum. And it is uterus is seen in the pelvis, true pelvis, between the urinary bladder and the rectum. So between the urinary bladder and the rectum, we can see the muscular organ, that is the uterus. And it is thick-walled and firm. You can see this is the cross section. Here we can see this thick-walled. Wall is thick, and the cavity is so small cavity. And because of this thick wallness, we can palpate the uterus through per vaginal examination. And what about shape and size of the uterus? The uterus is a pyriform shape organ. It is a pear shape or pyriform shaped structure organ, and it has a length of about 7.5 centimeter. So length of about 7.5 centimeter and has a breadth of about 5 centimeter, and it has a thickness of about 2.5 centimeter, and it has weight of about 30 to 40 grams. And see parts of the uterus. Here we can see this upper expanded part is known as body, and lower part is known as cervix, and junction between the, here we can make out, so this is the body, and here comes the cervix. Here junction between the body of the cervix, this is known as isthmus. And we can see the angulations and normal position of the uterus. So normally the long axis of the uterus, so here we can see the long axis of the uterus forms an angle of 90 degree with the long axis of the vagina. So this is the vagina, we can see. So this is the long axis of the vagina, and here comes the long axis of the uterus. So long axis of the uterus forms a 90 degree angle with the long axis of vagina, and this is known as angle of anteversion. This is then, so that is known as angle of anteversion. Angle of anteversion, that is the long axis. Long axis of the uterus with the long axis of the vagina. So that is the angle of anteversion. So this is the normal angle, that is 90 degree angle here. So in some cases we can see this is our urinary bladder. So here they can see the uterus is bending anteriorly. This is anterior part, this is posterior part. Here we can see the vertebrae. So main part, that is body of the uterus, will be bent over the urinary bladder. So it has an anterior bending. This is the normal position of our uterus. So this is known as angle of anteversion. And in some patients we can see this uterus will be bent backward. Instead of coming anteriorly, it is going posterior. So that condition is known as angle of retroversion. Angle of retroversion. So for the scanning report and all, you can see anteverted uterus, like that they will be writing. So this is the normal position, anteversion. So angle of anteversion, that is 90 degree. And one more angle can be seen between the long axis of the body and the long axis of the cervix. This is the long axis of body and the long axis of the cervix. So there is another angle within the uterus itself, that is known as angle of anteflexion. So what this is 125 degree angle. 125 degree between the body and the cervix. So this is known as angle of anteflexion, and it is 125 degree. So these are the two angles, angle of anteversion and anteflexion. The next is communication. So here we can see this is the sagittal section where we can make out the cavity of the uterus. So this is the uterus cavity of the uterus. So communication of the uterus, we can see superiorly on either side. It is known as superolateral angle, or this portion is known as cornu or horn of the uterus. This is superolateral angle or horn of the uterus. So here we can see the superolateral angle or cornu of the uterus. It will be communicating with the uterine tube. So either side, superiorly it will be communicating with the uterine tube, and inferiorly it is communicating with the vagina. So this is the vagina. Inferiorly it is communicating with the vagina. The next is parts of the uterus. The upper bulged portion. This part is known as the upper part of the body. This bulged portion is known as fundus of the uterus, and lower part, this main part, is known as body of the uterus, and this constricted part is known as isthmus of the uterus, and this portion is lower part, this is known as cervix of the uterus. So fundus, body, isthmus. So here we can see a constricted part. This is the isthmus, and here comes the cervix. Then on either side, the uterus has two lateral borders. Here we can see one lateral border and two lateral borders on either side. It has two lateral borders. And the body of the uterus has two surfaces. It has anterior surface, or it is known as vesical surface, which is related to our urinary bladder. And showing the other diagram, already seen. Here. So this surface is known as anterior surface. It is related, or it is known as vesical surface, because vesical is a term related to urinary bladder. So this surface is known as anterior surface, which is related to urinary bladder, and there is a posterior surface, or it is known as intestinal surface, because it is related to rectum and intestine. Okay, this portion, intestinal surface. So two surfaces for the body, anterior surface and posterior surface. Then this fundus. Fundus is the upper bulged portion of the uterus, and we can see it lies above the opening of the uterine tube. It lies above the opening of the uterine tube. So this part is known as fundus. Fundus of the uterus. So it is like a convex, and like a dome. It is a dome shaped structure. It is convex, and it is covered with peritoneum. And there is then the body. This is the body of the uterus. So body of the uterus, anteriorly there is the anterior surface or vesical surface, and posterior this anterior surface is flat, and posterior surface is convex. Posterior surface is convex, and anterior surface is flat surface. Okay. And anterior surface is related to urinary bladder. Posterior surface will be related to the rectum. And these posterior surface and anterior surface are separated by two pouches, peritoneal pouches. In this picture we can see this is a urinary bladder, a uterus, rectum. Okay. Here we can see between the urinary bladder and the uterus there is a pouch. We can see there is a pouch formed by the peritoneum. So that is known as vesico-uterine pouch. Vesico-uterine pouch here. So anterior surface is related to vesico-uterine pouch. Like that, here also one more pouch can be seen, that is known as recto-uterine pouch. Recto-uterine pouch. Okay. So two pouches can be seen in the anterior and posterior surface of the uterus. One is vesico-uterine pouch and another is recto-uterine pouch. Okay. Two pouches can be seen in relation to the body of the uterus. Okay. Then it has two lateral borders. The borders are rounded and convex. Lateral borders are rounded and convex, and it provides attachment to the broad ligament. This yellow color structure, this is the broad ligament of uterus. Broad ligament, you can see this one. So this is the broad ligament. So this is the broad ligament of uterus. So lateral border gives attachment to the broad ligament of uterus, and also it gives attachment to the uterine tube. In the upper part of the border, uterine tube, and below the uterine tube you can see the attachment of the ligament of ovary, and below that the lateral border is related to the uterine artery. In this picture you can see this is our uterine artery. It is going upward through the broad ligament. Through the broad ligament it passes upward. So it is related to uterine artery. And in the sagittal section, the cavity of the body of uterus we can see. See, this is triangular in shape. Sorry, this is coronal section. So in the coronal section, it can be seen as a triangular in shape, but in the sagittal section, we can see it is a slit-like opening. Already seen. So this one. So it is seen as a slit-like opening in the sagittal section. Okay. The coronal section, we can see it is triangular in shape. Cavity, uterine cavity is triangular in shape. And its apex is directed downwards towards the opening of the cervix. So the junction between the opening of the uterine cavity and the cavity of cervix is, this part is known as internal os. Okay. Then the cervix of the uterus. The cervix of the uterus is a lower cylindrical part of the uterus. It is less mobile than the body, and it is about 2.5 centimeter length. It is 2.5 centimeter in length, and the lower part of the cervix projects into the cavity of the vagina. Here we can see the lower part of the cervix projects into the anterior wall of the vagina, and divides it into supravagina. Divides the vagina into which divides into supravaginal parts and the vaginal part. Divides this part. The cervix is again divided into supravaginal part and vaginal part. Vaginal part means seen inside, the part which is seen inside the vagina. This part is the part above the vagina. This is supravaginal part. Okay. Then the supravaginal part of cervix is related anteriorly to the urinary bladder, that we already see. Anteriorly it is related to urinary bladder, and posteriorly it is related to the recto-uterine pouch and rectum. Okay. On either side it will be related to the ureter. Here comes the ureter on either side. This diagram you can see. This is the ureter. So cervix, upper part of the cervix is related to the ureter, the upper part. Then is related to ureter. And also here we can see uterine artery. Uterine artery is going, this is a uterine artery. Uterine artery is going inside. Not this one, going through the uterine broad ligament. Then vaginal part of the cervix. So this vaginal part of the cervix projects into the anterior wall of the vagina, and space between it and the vaginal wall is called vaginal fornix. This is known as vaginal fornix, this portion. Vaginal fornix. Space between the vagina and the cervix, that is known as vaginal fornix. Cervical canal, and the cavity inside the cervix is known as cervical canal. The cervical canal opens superiorly to the uterine cavity through a small opening. This is known as internal os, and it opens towards the vaginal cavity through the external os. So here comes the internal os and the external os. External os and internal os. And in a nulliparous woman, the external os will be small, and is bounded by anterior and posterior lips of the cervix. Anterior and posterior lips can be seen in the cervix in nulliparous women. And inside, if you are looking inside the cervical canal, we can see the mucosa is folding and forms the branches of a tree. Here we can see it is seen like branches of a tree. So this is known as arbor vitae uteri. Arbor vitae uteri. Mucosa of the cervix, cervical part of the uterus. It seems like the branching pattern of a tree. So it is known as arbor vitae uteri. Then next is the ligaments of the uterus. There are two types of ligaments. False ligaments or peritoneal ligaments are there, and true ligaments or fibromuscular ligaments are there. Okay. First one is peritoneal ligaments or false ligaments. First ligament is the anterior ligament. Anterior ligament consists of utrovesical fold of peritoneum. So that is the anterior ligament. So this one here we can see this is anterior and posterior. So this here there is a fold of peritoneum like this, which forms the vesico-uterine pouch. Okay, so this fold is known as anterior ligament, and posterior ligament is formed by the recto-vaginal fold. It is forming the recto-vaginal pouch of peritoneum, recto-vaginal fold. Okay, posterior ligament, and there is right and left broad ligaments. So this is the broad ligament, right and left broad ligament. Here we can see, which is attached to the lateral side of the lateral border of the uterus to the pelvic wall. It will be attached to the pelvic wall. Okay. So the broad ligament, it is formed by two folds of the peritoneal foldings. Okay, and two folds will be continuous in the upper end, like this. You can see two layers are there, one and two layers. Okay, so it will be continuous in the upper part, and it is going like this, folding like this. Okay, this is the broad ligament, and the upper part of the the ovary is attached to the posterior layer of the broad ligament through a small piece of broad ligament that is known as mesovarium, and the part of the broad ligament between the uterine tube and the ovary, and this is known as and the ligament of ovary here, and this part of the broad ligament is known as mesosalpinx. Okay. And then the part below the ligament of ovary here, which is broad ligament below the ovary, is called mesometry. This part is known as mesometry. Below the ligament is known as mesometry. So the complete portion is known as broad ligament. Upper part of between the uterine tube and the ovary and ligament of ovary, this is known as mesosalpinx, and below portion, this lower portion, is known as mesovarium. Okay. And the structures inside the broad ligament are the uterine tube. Here we can see uterine tube, then the round ligament of uterus, that we will study later, round ligament of uterus, then ligament of ovary, then uterine vessels. We already seen uterine vessels, uterine artery and uterine vein passes through the through the broad ligament, then epiphorein and euphorein. These are the small tubule-like structures, developmental remnants of the tubes. Epiphorein and paraphorein can be seen, and some lymph nodes also can be seen inside this broad ligament. These are the three peritoneal fold or the false ligaments: anterior ligament, posterior ligament, and broad ligaments. Then next is true ligaments. So there are three true ligaments for the uterus. First one is round ligament of uterus. So here we can see this is the round ligament of uterus, is going towards the inguinal canal. So this is the round ligament of uterus, and transverse cervical ligaments. So on either side, transverse cervical ligaments, that is seen this one, transverse cervical on either side of the cervix. Okay, transverse cervical ligament on either side, transverse cervical ligament. Then uterosacral ligament, that is ligament between the uterus and the sacrum, uterosacral ligament, which is going backward. Posterior ligament, uterosacral ligament. So these are the three true ligaments: round ligament, then transverse cervical ligament, then uterosacral ligaments. Okay, these are the three ligaments of uterus. Supports of uterus. They are the structures which helps in the to give support during the pregnancy time and other times, and it prevents the prolapse or downward movement of the uterus during parturition other time. And primary supports are the pelvic diaphragm. Here we can see some muscles which forms the diaphragm here, pelvic diaphragm. So this will prevent the fall of the uh, internal organs to collapse downward. So here we can see this is actually urinary bladder, but here we can see some muscles which forms the diaphragm. These are the pelvic diaphragm muscles. So here in this section we can make out like this muscles will be forming a diaphragm that is known as pelvic diaphragm. This will helps in it prevents the fall of the internal organs outward. Okay. So that is the first structure, that is pelvic diaphragm. Okay. Pelvic diaphragm. And next is a perineal body. This is the perineal body. Here we can see this is the perineal membrane, and here comes the perineal body. So perineal body is actually a fibromuscular structure which helps in the attachment of all the muscles here. That is perineal body. Then the distal urethral sphincter mechanism. This is urethral sphincter. This sphincter also helps in the support of the uterus. Okay. Then the other secondary supports are the broad ligaments. We already see broad ligament of the uterus. Then rectovesical pouch, rectouterine pouch. Everything will helps in the supporting the uterus. Okay, these are the support of uterus. Then next is the histology of uterus. So this is the section of a uterus, uterine wall. Here we get this is the mucus part of outermost part or innermost part, that is mucosa. Here we can see it is lined with the columnar, simple columnar epithelium, mucosa. This is simple columnar epithelium. Mucosa is lined with columnar epithelium, and below that we can see the submucosal part where we can see the lamina propria. Inside the lamina propria there are so many uterine glands are there. So these glands will enlarge depends upon the stages, various stages of the menstrual cycle. Okay. And below the lamina propria we can see it is formed by the muscular layer that forms the endometrium. This is the endometrium. Okay. The endometrium we can so this is the endometrium. This part is known as endometrium, mucosal part. This is epithelium plus lamina propria, the glandular part. So up to here is the endometrium. Below there, this part is known as myometrium. The myometrium we can see the smooth muscle fibers are arranged in the different manner. That is inner middle layer smooth muscle fibers, that is myometrium, and in the myometrium comprises of different thick bundle of smooth muscle fibers. See, here we can see the smooth muscle fibers. In between the smooth muscle fiber, the smooth muscles are arranged longitudinally and circularly, and also it is arranged, and in between the muscles fibers we can see fibrous tissues are there, and also fibers are there. Between the muscles fibrous tissues can be seen, and there are coiled spiral arteries can be seen, coiled spiral arteries. Blood vessels can be seen here and there. These are the blood vessels inside the myometrium. Okay, here also we can see the blood vessels, and this is there are different stages for the endometrium. It depends upon the stages of menstrual cycle. Okay. And first is this picture we can see. So depends upon the various stages. There are 3 stages for the uterine wall. Depends upon the cyclic changes. Okay. So first stage is known as proliferative stage. So proliferative stage we can see the lined by columnar cells, and below that we can see simple tubular glands can be seen. Tubular glands in the lamina propria. Here it is same muscular layer. In between the muscular layer fibers can be seen, and arteries also can be seen. Then coming to the next stage, that is known as progestational phase. In the progestational phase we can see the glands become sacculated and become tortuous, and it will be filled with fluid. Okay, and thick secretions, the endometrium become thick comparing to here. See, thickness of the endometrium increases, and the vessels become tortuous, and the blood vessels become tortuous, and this is the second stage. Then third stage is the menstrual phase. In the menstrual phase what is happening, the arteries will burst out, and the upper part of the endometrium will be so here we can see this is the gestational stage. Okay, second stage, and this is, or it is known as secretory stage. This stage is known as secretory stage, where we can see the glands are tortuous and arteries also tortuous, and it will thickness of the myometrium is increased. Okay. And next is the next stage, that is our this one. See, this is the menstrual phase. Here we can see the glands upper part of the endometrium will be broken down, and the glands also pour the secretion out. Here the coiled arteries also break. So these arteries will break, and because of the change in the progesterone and estrogen level, sudden changes in the progesterone and estrogen level result in the burst out of the glands and arteries, resulting in the pouring of blood outward. Okay. So the blood will go outward, and that process is known as menstruation. Okay. So this is the menstrual phase of the uterus. Menstrual phase. Here arteries will break and it pour the blood out. Okay. So that is the menstrual stage. So these are the three stages of the uterus. Blood supply and nerve supply of the uterus. So it is arterial supply, it is by the uterine artery, mainly by the uterine artery, and some part it will be supplied by the ovarian artery. So chiefly by the uterine artery and partly by the ovarian artery. And venous drainage, it is plexus, it forms a plexus on the lateral border of the uterus, and this finally drains into uterine vein, ovarian vein and vaginal vein, and finally into the internal iliac veins. Then lymphatic drainage. So lymphatic drainage finally drains into the aortic lymph nodes, and external iliac lymph nodes. Lower part of the body and the upper part of the cervix drains into the external iliac lymph nodes, and vaginal part and the lower part of the cervix drains into the internal iliac lymph nodes and also into the superficial inguinal lymph nodes. Then nerve supply, it is supplied by the sympathetic and parasympathetic. Sympathetic from T12 L1 segments, and parasympathetic by S2, S4 segments. Sympathetic and parasympathetic. So sympathetic causes uterine contraction and vasoconstriction, and parasympathetic helps in vasodilation and inhibition, uterine inhibition. And pain sensation from the body of the uterus passes through the sympathetic nerves, and from the cervix along to the parasympathetic nerves. Then age changes of the uterus. So there will be some changes in the age. So in the fetal life, the cervix, in the fetal life you can see this is newborn. So in the fetal life, and the cervix will be larger than the body. So here we can see this is our cervix and this is the body. So cervix part is larger than the body in the newborn and the fetal life. Okay. And when coming to the here also it is saying the up to puberty. So when it reaches the puberty, you can see the uterus will enlarge and descend into the adult position. And here we can make out the arbor with uteri. Then during the pregnancy time, so this is the adult nulliparous portion. Here cervix becomes small, and the body and fundus become enlarged. Okay. And this is the pregnancy time. During the time of pregnancy, uterus enormously will enlarge, mainly due to the division of the smooth muscles. The smooth muscle will get enlarged, and the causes thickness, progressive uterine wall become thinner, and we can see on the after birth. This is the during pregnancy time and after pregnancy, that is when it becomes post-menopausal old age, the uterus become atrophic and smaller, and it's smaller in size, and internal os will be obliterated. Here see, we can see internal os will be obliterated, and external os may be disappear sometime. Yeah. So these are the changes. Here we can see one more uterus, position of uterus. I will show you. See the position of the uterus during the pregnancy time. So this one. So here we can see it will from the pelvic cavity. This is our pelvic cavity. So from the pelvic cavity it reaches the abdominal cavity. See, it reaches up to our diaphragm. This is the diaphragm. So this is one position of the uterus. Okay. For the applied anatomy of uterus, here we can see the usually it is the most common site for the fibroid formation of fibroids. Here we can see fibroid formation here and there. Fibroids can be seen. That means normal tissue is replaced by the fibrous tissue. Okay. And next is colpotomy or colporaphy, means it is the drainage of pus from the pouch of Douglas. The intrauterine device is used to prevent the implantation. See, this is the T device, which is intrauterine device, which help in preventing the fertilization. So copper T. So like this we have to implant a T-shaped structure will be implanted inside the uterine cavity in order to prevent the fertilization. Yeah. And sometimes, because if there is any problem for the support of the uterus, and the uterus will be fall down, prolapse of the uterus. Okay. Usually it will be happen during the delivery time. So this is our vagina, and here comes, this is the cervix, the fornixes of the cervix. And during after the parturition, normal delivery time, what will happen if there is, this is the support of, this is the diaphragm, pelvic diaphragm. You can see if there is any problem with the pelvic diaphragm, if it will lose the support of uterus, and this uterus will fall down. So that condition is known as prolapse of uterus. So these are the main applied aspect for the uterus.